Do you know the silent signs of a stroke? It's a question that we should all be able to answer with a resounding yes, but sadly, many of us are in the dark. Strokes are a leading cause of disability and death worldwide, and the early recognition of their symptoms is crucial for the best chance of recovery. This is not a topic to be taken lightly. It's about understanding the whispers of our bodies, the subtle hints that something might be amiss. It's about arming ourselves with knowledge and acting swiftly when it matters the most. It's about saving lives, possibly our own. But how can we recognize these silent signs? What should we be looking out for? Fear not, because we're about to dive into this critical topic. Fasten your seatbelts because knowledge is power, and we are about to become more powerful. In this video, we will discuss the 10 silent signs of a stroke that you should never ignore. The first silent sign of a stroke is sudden confusion. Imagine being in the middle of a conversation and suddenly, you're at a loss for words. Or perhaps you're in the midst of your daily routine and suddenly, you can't recall what step comes next. This isn't your usual forgetfulness. It's a sudden and unexplainable confusion that engulfs you. This sudden confusion can manifest itself in various ways. It might be difficulty understanding what others are saying, or it could be trouble remembering familiar names or places. This can be a frightening experience, and it's not something to be ignored. Such confusion can be an indicator of a stroke. It happens because a stroke disrupts the flow of blood to the brain. This deprives the brain of oxygen and nutrients, which can cause cognitive issues like sudden confusion. Remember, if you or someone else suddenly becomes confused, it may be a sign of a stroke. The second silent sign of a stroke is trouble speaking. This symptom can be a subtle one, often ignored or brushed off as simple forgetfulness or a momentary lapse. It can manifest itself in various ways. You might find yourself struggling to articulate words, or your speech could become slurred and difficult to understand. Perhaps you're suddenly unable to recall common words or phrases, or you're speaking in nonsensical sentences. Why does this happen? Well, when a stroke occurs, it cuts off blood flow to parts of your brain. Depending on the area affected, this can disrupt the neural pathways responsible for speech and language. Hence, your ability to communicate takes a hit. So if you or someone around you is suddenly experiencing difficulty speaking, don't dismiss it. This seemingly minor symptom could be a warning sign of a much larger issue. Keep in mind, if speaking becomes suddenly difficult, it could be a stroke. The third silent sign of a stroke is difficulty understanding speech. This symptom can surface in a variety of ways. You may find that you're unable to follow along in conversations as you typically would. Words might seem jumbled, or sentences could feel as if they're in a foreign language. You might also notice a delay in processing spoken words, like there's a lag between hearing something and understanding what it means. Now, why is this a possible sign of a stroke? Well, a stroke occurs when blood flow to a part of your brain is cut off. This can damage areas of the brain responsible for interpreting and processing language, hence the difficulty in understanding speech. It's important to note that this symptom may come and go, or it may persist. Either way, it's not something to brush off. Remember, if understanding speech suddenly becomes difficult, it may be a sign of a stroke. The fourth silent sign of a stroke is vision problems. When we talk about vision problems, we're not referring to the typical need for glasses or contacts. We're talking about sudden, unexplained changes in your sight. This could manifest as double vision, blurred vision, or even loss of vision in one or both eyes. Why does this happen? Well, strokes can interrupt the blood flow to the part of the brain that processes visual information. This disruption can cause these sudden vision changes. It's important to note that these changes might not be permanent, and can sometimes resolve shortly after onset. However, they should never be ignored. The type of vision problem can vary greatly from person to person depending on the area of the brain affected. So, should you experience any sudden vision problems, don't shrug it off or chalk it up to tiredness. It's better to be safe than sorry. So, sudden vision problems could be a silent sign of a stroke. The fifth silent sign of a stroke is balance issues. Now, you may wonder what we mean by balance issues. Imagine feeling wobbly or unsteady on your feet, even when standing still. Or perhaps you find yourself struggling to coordinate your movements, as if your body isn't responding as it should. These are examples of balance issues, and they can be a serious red flag. But why does a stroke affect balance? Well, a stroke happens when blood flow to a part of your brain is cut off. This lack of oxygen-rich blood can damage brain cells that control your sense of balance and coordination. So if you're experiencing sudden and unexplained balance issues, it might be your body's way of signaling a stroke. However, remember that balance issues can also be caused by other factors, such as ear infections or certain medications. So it's important not to panic, but to seek medical attention promptly. Remember, if you or someone else suddenly has trouble with balance, it could indicate a stroke. The sixth silent sign of a stroke is a sudden severe headache. This isn't your typical headache that you might get from stress or lack of sleep. No, this headache comes out of the blue and hits you like a freight train. It's severe, sudden, and unlike anything you've experienced before. Often described as the worst headache of my life, it's a pain that's intense and throbbing, and it can even be accompanied by nausea or vomiting. It's not localized to one area, it's all-encompassing, like a vice grip around your skull. But why does this signify a stroke? Well, a stroke happens when blood flow to a part of your brain is cut off. This sudden severe headache could be a warning sign that there's a blood vessel in your brain that's either blocked or bleeding. It's crucial to remember, not all headaches are indicative of a stroke. But if it's sudden and severe, it's better to be safe than sorry. So, a sudden severe headache could be a silent sign of a stroke. The seventh silent sign of a stroke is numbness or weakness of the face, arm, or leg. This feeling of numbness or weakness can often be sudden and unexpected. You might notice your face drooping on one side, or discover that you're having difficulty lifting your arm or leg. This happens because a stroke interrupts blood flow to an area of your brain, which in turn affects the nerves controlling these parts of your body. The result? A sudden loss of strength or sensation. It's important to understand that these symptoms can occur individually, or they might all happen at once. Regardless, they are all serious indicators of a possible stroke. If you or someone around you experiences these symptoms, it's crucial to seek immediate medical attention. A swift response could make the difference in recovery. Remember, sudden numbness or weakness could be a sign of a stroke. The eighth silent sign of a stroke is dizziness. This is more than just a fleeting feeling of unsteadiness. It's a sensation that can make you feel as though the room is spinning, or that you're about to fall. You might find it hard to keep your balance, or you could even feel as if you're moving when you're actually standing still. Why does this happen during a stroke? The answer lies in the fact that our brains are responsible for maintaining our sense of balance. When a stroke occurs, it disrupts the blood flow to the brain. This can affect the parts of the brain that help us stay balanced, leading to feelings of dizziness. But remember, dizziness can be caused by many things, not just stroke. It could be due to low blood pressure, dehydration, or even an inner ear problem. However, if dizziness comes on suddenly and is accompanied by other stroke symptoms, it's time to seek immediate medical help. Remember, if you or someone else suddenly feels dizzy, it could be a sign of a stroke. The ninth silent sign of a stroke is difficulty walking. Let's delve a little deeper into this. Difficulty walking can manifest in various ways, such as stumbling, unsteady gait, or sudden loss of balance and coordination. These issues arise due to the disruption of the blood flow to the brain caused by a stroke. This interruption affects the part of the brain responsible for muscle control, leading to complications like unsteadiness or even paralysis. Imagine walking on a tightrope with a heavy load on one side. The balance is off, right? That's how the brain feels when a stroke hits one side more than the other. It tries to compensate, but the result is often a noticeable difficulty in walking. It's crucial to understand that these signs might not always be pronounced. Sometimes they are subtle, but no matter how minor they may seem, they should never be ignored. Remember, difficulty walking could be a silent sign of a stroke. The 10th silent sign of a stroke is unexplained fatigue. This isn't just the kind of tiredness you feel after a long day or a poor night's sleep. We're talking about a sudden, profound exhaustion that doesn't seem to have a clear cause. You might feel overwhelmingly tired even if you've had plenty of rest and haven't been exerting yourself. This happens because a stroke disrupts the blood flow to your brain. Your brain needs a constant supply of oxygen and nutrients to function properly. When a stroke occurs, it cuts off that supply, forcing your brain to work harder to perform even simple tasks. This extra effort can drain your energy, leading to feelings of severe fatigue. It's important to note that unexplained fatigue can be a symptom of many different conditions, not just strokes. But if it's accompanied by other stroke symptoms, it's a cause for concern. Don't ignore it. Remember, if you or someone else suddenly feels unexplained fatigue, it could be a sign of a stroke. So, those are the 10 silent signs of a stroke that you should never ignore. The journey we've embarked on today has been enlightening, hasn't it? We've traversed the landscape of silent stroke signs, each more critical than the last. Let's take a quick look back at the significant landmarks we've passed. We first encountered sudden confusion. This is when the world around you seems to lose its sense and you find yourself unable to comprehend simple tasks. Then we stumbled upon trouble speaking, where forming words becomes a challenge and your tongue feels heavy and uncooperative. Next, we navigated the haze of difficulty understanding speech. It's like being in a foreign country where you don't speak the language, you hear words but they don't make sense. Vision problems followed, where your sight may blur, dim, or completely go dark. We then braved the unsteady terrain of balance issues, where the world seems to tilt and sway under your feet. A sudden severe headache came next, striking like a bolt out of the blue with no apparent cause. The journey continued with numbness or weakness of the face, arm, or leg. It's as if part of your body has fallen asleep but the sensation doesn't go away. Dizziness, like standing on a boat in a stormy sea, was our next signpost. Then we faced difficulty walking. Your legs may feel heavy or you may stumble without any apparent reason, and finally, we ended with unexplained fatigue, a deep-seated weariness that doesn't go away with rest. Each of these signs is a critical beacon, a silent alarm that something may be wrong. If you or anyone around you experience any of these signs, it's essential to seek immediate medical attention. Time is of the essence when it comes to stroke. Remember, recognizing these silent signs of a stroke could save a life. Stay vigilant and take care of your health.